Hello, my name is Summer Mazzantini. I am a United States University student. I am going to set a stopwatch right now so I can do my time. This is for discussion for week 4. It is about, the assignment is supposed to be a presentation going over a pulmonary complaint that I saw in the clinic. And I've actually seen this patient a couple times. She's been in almost every week since I first started on my clinical rotation. And now I'm going to begin. So my patient initials are TS. She's a 69-year-old female. She comes into the office with the chief complaint of shortness of breath, cough, and low oxygen levels. After leaving the hospital, she was discharged from the hospital, so she was coming in for post-discharge hospital appointment. But she's still not feeling well, having a lot of fatigue, not able to get up and walk around. So the history of the present illness is she's a 69-year-old female after the recent hospitalization, and she was diagnosed with pneumonia while she was at the hospital with persistent symptoms of shortness of breath, productive cough, and hypoxia. She reports that she has worsening dyspnea over the last several days, and she's been having to not be able to get up and walk around. She has minimal exertion, notes her oxygen levels have remained low, even though she uses a baseline of 3 liters nasal cannula at home. She also endorses a chronic cough that has increased. She denies any chest pain, but she does report fatigue and decreased activity intolerance. The patient also has a 55-year smoking history, which she supposedly quit, but that was only recently when she was hospitalized is when she quit. She has a known diagnosis of COPD and severe emphysema, so she is a high-risk patient for pulmonary infections and exacerbations. Other past medical history for the patient is that she has been diagnosed with COPD. She's on 3 liters nasal cannula at baseline. And she has severe emphysema, hypertension, and lupus. At the visit, her vital signs presented as such. She was 117/80 for blood pressure. She was tachycardic at 115 beats per minute. Her oxygen saturation was 88% on the 3 liters nasal cannula. She is a very tiny lady, weighing in at 112 pounds. Height is 5'6". Respiration rate was also elevated at 22. For the physical exam findings, her general findings are that she is thin, appears fatigued, and in some distress. She's anxious. She definitely looks as she's not at her baseline. Respiratory-wise, she has decreased breath sounds bilaterally. She does have some wheezing and fine crackles. Cardiovascular-wise, she was tachycardic, but she had a regular rhythm. Skin, she has no cyanosis, but she does have very fine, thin skin. Extremities, no edema, also very weak, just really couldn't do a lot of movement, was in a wheelchair. So the differential diagnosis for this patient is unresolved pneumonia, a COPD exacerbation, and also we would definitely want to rule out pulmonary embolism. But the final diagnosis for her is community-acquired pneumonia unresolved, because she was already hospitalized and she was on antibiotics in the hospital, and then she was sent home on antibiotics, and clearly she is still not recovering as well as she should be. So the plan for her will be to for sure get a chest x-ray. We want to evaluate the pneumonia, so even though she's probably had several chest x-rays, we want to go ahead and get a chest x-ray today so we can compare it to the chest x-rays that she had in the hospital. We would want to get new labs for her, and if we can, get a sputum culture, of course. That's also kind of hard to get, but we will definitely try. And then we will start her on some new medications. We will start her on a short-acting bronchodilator, albuterol plus ipratropium. We want to also give her a dose of steroids. We'll give her an injection of dexamethasone. And then we're going to want to start her on antibiotics. She was already on failed antibiotics from IV antibiotics at the hospital, and she was already on failed home antibiotics of doxycycline and augmentin. Therefore, we are going to start her on Levaquin. This is the medication of choice for failed other options. We will also recommend that she keep her oxygen levels between 88 and 92, so she needs to titrate as needed at home on her oxygen. Education, we want her to quit smoking for good. Make sure she's using proper inhaler technique, and then make sure she either returns to the emergency room or back here if she's having worsening respiratory distress. We recommended her to follow up here next week and possibly again go to the ER if she has shortness of breath, increased chest pain, declining oxygen levels, or of course if she has any fever, any other systemic symptoms. And this is my presentation for now. References will be included in the assignment. Thank you.